In the heart of a veterinary clinic, every beep of a machine, every purr, and every wagging tail tells a story. With so many animals and a myriad of medical mysteries, how do professionals decide who gets the immediate spotlight? Dive with us into the intricate dance of decisions, known as veterinary triage. Triage. It's a term that's echoed through the annals of medical history, shaping decisions on battlefields, in bustling ERs, and yes, even in our veterinary clinics. But what exactly is triage? Originating from the French word, trier, meaning to sort, it's all about making choices under pressure. In our world, it's the art of deciphering whether Bella's sudden limp is more pressing than Max's midnight munchies on a mystery snack. Every day, in clinics worldwide, vets and technicians weave together a tapestry of decisions, guided by research, experience, and sometimes that hard-to-pin-down gut feeling. In essence, triage is our compass, ensuring the best care for our furry, feathery, and scaly patients. Alright, fellow professionals and future vets, let's deep dive into triage. As many of you might know, triage isn't just a one-size-fits-all deal. First up, we have telephone triage. It's our front line, based on the pet owner's voice, their urgency, and the snippets of information they provide. It's up to us to gauge if it's a code red situation or if they can wait just a tad longer. Then there's the waiting room triage. You know the drill, the clinic is jam-packed, and everyone believes their pet's case is the most urgent. But we have to make those crucial calls. It's not about first come first serve. It's about assessing and prioritizing based on urgency. And yes, those observational skills you honed during your training? This is where they shine. Lastly, there's the triage that happens during the physical examination. Here, every breath, every pulse, and every symptom counts. We become medical detectives, piecing together clues to decide the primary concern. Is it that persistent cough? The irregular heartbeat? Or maybe that unexplained bruise? It's a balance of knowledge, experience, and sometimes, trusting your gut. Now, research has consistently shown the efficacy of triage in improving patient outcomes. But like all systems, it has its strengths and limitations. While triage helps streamline care and prioritize, it's also dependent on accurate information and clear communication. And let's be real, there's always that element of unpredictability in emergency care. As budding veterinarians and seasoned pros, we've all been there, the moment of decision-making. But how exactly do we, in the thick of it all, decide who to treat and when? Let's unravel the layers of triage. First and foremost, triage is more than just instinct. It's a structured approach. Over the years, research has given us tools, scoring systems, and protocols to aid our decision-making. These aren't just arbitrary numbers. They're the result of meticulous research, trials, and real-world observations. From assessing vital signs to analyzing lab results, triage is all about gathering data. But it's not just about the numbers. It's about context. For instance, a raised temperature in a husky left in the sun differs from one in a cat that's been indoors. Our job is to piece together the entire story. Then there's symptom analysis. While a limp might seem straightforward, is it due to a sprain, a fracture, or an underlying infection? Triage helps us categorize symptoms based on their potential severity and immediate threat. While our instincts and experience are invaluable, triage systems offer a standardized approach, ensuring that we don't overlook or underestimate certain signs. Research-backed triage ensures consistency and, more importantly, optimal patient care. Now, it's worth noting that while triage systems are powerful, they're not foolproof. They're tools to guide our judgment, not replace it. Their strength lies in their systematic approach. But the limitation? They rely on accurate inputs. And in the dynamic world of veterinary emergencies, there's always an element of unpredictability. As we journey through the labyrinth of veterinary medicine, triage stands as one of our most trusted compasses. It's more than just a system, it's a commitment to ensure every bark, purr, chirp, or squeak gets the attention it deserves. Through research and protocols, we've honed this art, striving for the perfect blend of science and instinct. While triage offers us a structured approach, it's essential to remember its strengths and limitations. It's a tool, and like all tools, it's most effective when wielded with experience and insight. To all the professionals and aspiring vets out there, triage is a testament to our dedication, our challenges, and most importantly, our unwavering commitment to our furry, feathery, and sometimes scaly patients. Alright, all you vets and future vets out there, it's game time. Let's put that triage knowledge to the test. Think you can guess the triage level based on some quirky scenarios? Let's find out. Scenario 1. Mr. Whiskers has been Googling his symptoms again, and insists he needs an immediate appointment for his sudden urge to chase laser pointers. Is this telephone triage, waiting room triage, or examination triage? That's right. It's telephone triage. Scenario 2. Tommy the turtle strolls in, looking cool and relaxed. But the nurse notices he's got a little sunburn from his beach vacation. Which level of triage is this? Bingo! It's waiting room triage. Scenario 3. Polly the parrot is in for a checkup. She's perfectly healthy but won't stop repeating everything the vet says. We did say these would be quirky. Which triage level are we looking at? You got it. It's examination triage. How did you do? Whether you aced it or had a few chuckles, remember, triage is as much about knowledge as it is about adapting to the unexpected. And occasionally, the downright hilarious. If you've enjoyed this deep dive into the world of veterinary triage, and want to stay updated with more insights from the clinic, make sure to hit that subscribe button below. And if you found this video helpful or intriguing, give it a thumbs up and share it with fellow vets, technicians, and pet lovers. Thanks for tuning in, and remember, every click helps us spread knowledge and love for our furry, feathery, and scaly friends. See you in the next one.